13 years of age. It's all fear-driven. You carry the knife because of fear. You carry it, then you've got fear that you've got a knife on you. It's just, you're just riddled with 10 different forms of fear.
Scotland was often held up as being the knife capital, or Glasgow in particular, the knife capital of Western Europe. We had trauma surgeons travelling throughout the world to come to the Glasgow Royal Infirmary to learn how to deal with knife crime. But what we changed it to try and denormalise the feeling that everybody else was carrying weapons, to actually mean that people started to realise that weapons were actually in a minority. Weapons were no longer cool to carry. And what we've seen was, over a period of time, young people's attitudes towards carrying weapons and carrying knives changed.
Didn't know where I was going in life. I used to look at people and go, they know where they're going, they know what they're doing with their life, I don't know what I'm doing with my life. And I come here and I get a purpose. And there's nothing more rewarding at the end of the day when you've earned an honest day's work. And I'd been in and out of A&E for a very long time, and I hadn't met anybody in there who'd said to me, look, if you had enough of that lifestyle you're leading, we can show you how to maybe step away from it. And I grabbed it with both hands, because I kind of knew that I was running out of chances. I've got more lives than a Siamese cat.
Let's talk now to Assistant Chief Constable Mark Williams from Police Scotland. Also with us, Sophie Linden, who is London's Deputy Mayor for Policing and Crime. Lorraine Jones is here. Lorraine's son was a few months short of his 21st birthday when he was fatally stabbed in South London. And Mohammed Hashi was stabbed when he was a teenager. He's now a youth worker. Mark Williams, let's begin with you. This quite astonishing drop in knife crime since you changed your approach to it, since you started treating it as a public health issue. The Mayor of London wants an increase in stop and search to tackle the rise in the capital. Is that the wrong approach?
The approach that we've taken in Police Scotland has been an approach that has worked on a number of different levels. I think the public health approach that you've heard about this morning has been very successful. And what we've recognised as, I suppose, a policing service is that the police alone could never tackle the problems of violence in totality. There had to be a partnership approach taken. Now, part of our journey along the violence prevention success that you've seen has been stop and search, and we've seen a lot of changes to stop and search in recent years. The volumes of stop and search have actually reduced significantly over the last 4 years as a result of the new code of practice being introduced last year. So while stop and search remains a really important policing tactic, it isn't the be-all and end-all. It isn't a single solution, and the approach around public health as a whole is far more important. OK,
Sophie Linden, Deputy Mayor for Policing and Crime in London. Perhaps increasing stop and search is not the answer.
So we absolutely agree. An increase in the public in London should expect an increase in stop and search, but stop and search
should expect, do you say?
Where knife crime is increasing, stop and search is likely to increase. Being intelligence-led, properly done and effective stop and search should increase. But
look at what they've done in Scotland.
Absolutely. As Mark said, it isn't the only answer, and we published a knife crime strategy last June which very clearly put enforcement alongside a public health approach, and that's about early intervention and prevention. It's very interesting, the video you just showed around the interventions in hospitals. We've learnt from Scotland, and we are intervening in hospitals. We're funding youth workers to go into accident emergency units.
So why is the number of fatal stabbings in London going up then?
There's lots of complex reasons about why, and if there is a problem, we have a problem. It's increasing in England and Wales, but it's also increasing in London. And we know that it's only through enforcement with early intervention and prevention that we're really going to make progress on this.
Are you prepared to do what they've done in Scotland, i.e. help people with mental health problems, help them potentially get a job, help them get decent accommodation?
So I think one of the other interesting things in your package...
Sorry, could you just answer that question?
Yeah, no, absolutely. Please? In terms of the strategy, the Mayor is investing in mental health services in schools and in projects that help young people out of violence. But the Mayor can only go so far. And one of the interesting things in your package was that the Scottish Government is investing in this as well. Whilst the Mayor is investing in London, the Government is withdrawing funds to the key services that are going to make a difference. Schools in London are facing £99 million funding gap next year. Youth services across London have lost £22 million.
Disagreement?
Because again, it's the issue of the government. We can't keep doing things by ourselves. We need the support. And the money that keeps getting dragged out is affecting the young people. The young people are afraid. They're going through a whole host of issues. And as I agree with Sophie, it's not a police issue. Police are essentially enforcers. We need to be supporting the people around young people, around their mental health, around their family lives. It has to be a holistic approach. And withdrawing £99 million is not going to solve it. It's going to make it worse.
But do you see that approach? Do you see health professionals, education professionals wanting to pursue that approach, i.e. the Scotland approach?
I've been seeing it. Again, Leroy Logan and Gary Trousdale have put together a youth violence commission with Vicky Foxtrot, and I've sat in meetings and I've listened.
Leroy Logan is a former Met police officer.
Yeah, so, and I've seen the strategies they're putting together, but without the support from the government, it's like they're sitting on an island looking at us like we're in a zoo, and these problems don't affect them. Our kids are dying every single day, and they're withdrawing funds. I don't understand.
Lorraine, your son sadly lost his life a few years ago. You have spent time now trying to tackle knife crime, to help, you know, telling people not to carry knives. You've also been to Alabama.
Yeah.
And it sounds like they're doing quite similar things to Scotland.
They are doing similar things. In fact, they're doing a brilliant work there. And Alabama, Birmingham, Alabama, you know, the crime rate is just horrific there. It's a disease. It really is a disease. I mean, Scotland have hit the nail on the head. And we really need to look at it for what it is. These young people, they're sick. We have to deal with all the aspects of their well-being and mental health to be able to get to the root of this problem. Yes, Dwayne, he died of one single stab wound that went right through his heart. I haven't been able to bereave as a mother because I'm relentlessly campaigning. And like Hashi said, we need the government to support us. There are key people like myself and other services. With Scotland, they done a research in 2002. They went across the world to gather information to put this model together. We've got great inspirational people here in the UK, and the investment it's needed for us to tackle this together.
I want to put this to you, Mark Williams, if I may. What do you say to those who are watching now, who don't carry a knife, who don't get involved in violence, who've never broken the law, and think, perhaps, it's grossly unfair that your help is targeted at those who do break the law, violent, knife-carrying criminals who you will help get a house or a job or get help for their mental health and so on?
It's very important to understand that the health of the whole community is what matters. The well-being of our communities across Scotland is what comes first. And all of the social policy and the public health approach that leads to a healthier Scotland, a place where people are safer, and a place where people who do carry knives won't be tolerated, but equally are offered the opportunity to divert. They're offered the opportunity to do something different. And they understand the stigma around carrying a knife. And a lot of the work we do with young people in schools is very much about that. It's about influencing their decision making at the earliest stages of their lives. And what we understand, and I think what's just been touched on there, is that the value of academic evidence is really important, because we know that the adverse childhood experiences that often take place in the early years of some of the most deprived people in our communities have a massive impact on their future life chances and on the likelihood of them being incarcerated or suffering from mental health issues or suffering from chronic alcoholism or drug abuse. And all of that has to be taken into account when you're designing policies to address long-term reductions in violence.
And that's
what's happened in Scotland.
Yeah, when our guests here say, actually, we can't do that when money is being cut, is that a fair point from your point of view?
I would suggest that spending to save is the better policy to look towards, because investing in together with partners in the sort of policies we've done in Scotland and we've talked about this morning actually has a long-term financial impact on society. And you know, public health and social policy comes in lots of different guises, but the minimum pricing of alcohol, for example, that will kick off this year in Scotland will have a wide impact on society, not just on the reduction of violence, but in lots of other positive ways as well, including employability. So all of that needs to be taken into account.
Let me read this statement we have from the Home Office. Knife crime has devastating consequences on our communities. We're determined to tackle this head on. It's why we are collaborating with a number of partners, including social services, schools, the police and the voluntary sector, as well as local councils, to address the root cause of the problems. Last month alone, we provided £765,000 to local projects supporting communities in tackling knife crime. And the funds were given to projects focusing on young people, particularly those most at risk. We also fund young people's advocates who work directly with women affected by gangs to ensure they get the support they need to break the cycle of violence. And the Home Secretary has also announced a new serious violence strategy, which will be published early this year. Mohammed, you were stabbed when you were 15. I wonder if you would describe for our audience what it is like to experience that.
Do you know, it's interesting because for me, again, by the grace of God, I survived, you know, unlike Dwayne, unfortunately. And for me, what it was is the fear that I was infected with afterwards. For the next 4 weeks, I carried around a screwdriver.
Wow. Because
I was afraid that the imbalance of power, I was attacked by a group who had knives and I had no knife. So for me, there was a fear that that imbalance will happen again. And it's that fear that keeps infecting our young people today. The reason they carry knives, you know, it's publicized, you know, across all the media that it's a fashion and not a fear. It's the fear that drives them, because I was terrified. And then I was angry, which is not a good place to be when you have a weapon on you. So you could get into a minor argument and the first thing you're thinking is, I'm even more powerful because I've got this weapon with me. And for me, what does it happen? For me, as a victim, I can only imagine being stopped by the police and then finding that screwdriver, because in my head, I will feel like I'm re-victimized again. Because I've already been victimized, and that's why I'm carrying that, for fear. I think a lot of young people that are carrying knives, the fear is infectious. And the question that you just asked about people that are not involved in crime or not carrying knives, they are not immune to this fear.
What would you say, Lorraine? You're nodding in agreement.
Yeah, I mean, I had so many young people coming to my service wearing bulletproof vests as part of their dressing attire. That's the level of fear that young people are going through. And it's rippling into the family. We don't just need to support the young people, we need to support the families as well, the parents, especially in cases like mine, where we've lost a child. The rippling effects are devastating. Sorry, it's devastating because we've got hard-working professionals like myself that have been working relentlessly to build this country, that have now become victims. Who's helping us? I mean, thank God I'm a strong woman, and I've channeled my pain turn it into power to work with the police, with the government, with other services to tackle this. But I'm a pastor, and I pastor so many families. We have a man that's going to bury his son on Friday. His son was brutally stabbed multiple times. Dwayne had one single stab wound. His son had multiple stab wounds. He's a faithful bus driver. Now, he's in trauma, shock and grief. This is a disease that ripples through the family into the community, and it's that serious that it needs to be dealt with.
Thank you very much, Lorraine. Thank you for coming on the programme. Thank you, all of you. Appreciate your time. And Mark Williams from Police Scotland, really appreciate your time. Thank you.
Thank you.
Thank you. Still to come in the next half hour of the programme, we'll be speaking to a reporter who went undercover to an all-male charity event where the female hosts were allegedly groped and sexually harassed. 10:30, we're going to bring you all the latest news headlines now. Here's Ben.
Thanks, Victoria. The number of prosecutions which have collapsed because police or prosecutors did not follow rules about disclosing evidence has risen by 70% in England and Wales over the last 2 years. Proceedings were dropped against more than 900 people in the 12 months to last April because of problems with evidence. The issue's been highlighted by some recent rape trials, which have put the judicial process under scrutiny. UK unemployment fell by 3,000 to 1.44 million in the 3 months to November. The number of people in work